have C1, so this is the anterior arch, and then you have the anterior tubercle of C1, and then you have the posterior arch of C1, and then you'd have C2 down below. This is the vertebral body, and the vertebral body extends into the dens, which articulates with C1 as it goes up here, and then you'd have the posterior arch of C2. C3, you have the vertebral body right here, and then C4 and so on. You can't actually see C7. Between the vertebral bodies, you have the intervertebral disc space. You can't actually see the disc because it is not dense enough and not radiopaque enough. And then posterior to that is the transverse process. So you have the transverse process here, and it has a unique shape because it is bifid, much like the spinous processes, in that it has an anterior and posterior tubercle to the transverse process. Then we would have the pedicle, and you can see a good pedicle down here on, 4, 5, 6. Between this space, you would have the neuroforamen, or the intervertebral foramen, in which the nerve root comes out of. And the nerve root comes out, and this would be the ventral ramus, and it kind of goes posterior to the vertebral artery, which the vertebral artery would be running all the way up here between the transverse foramen, or the foramen transversarium. Posterior to that, you'd have the lateral mass. And the lateral mass, I'm trying to outline them all sort of stacked on one another. And they are basically articulating with one another. And you'd have an inferior articular process and a superior articular process. And those together would then make the zygapophyseal joint, or the facet joint, or the Z joint. Behind that is the spinal canal, and that would basically be this diameter. And then behind that would be your spinous process.